On today's show, I would like to welcome Danny Van Leeuwen. Danny is a nurse, a family man, a patient himself, and the founder of Health Hats, an international blog.
I would say that came through the Society for Participatory Medicine. And so E is enabled, empowered, educated. There's probably more E's, but I can't remember them right now. And it's that patients are the drivers of their health journey. I think you don't drive alone. You drive with a team. I'm really interested in that team and what works for that team and what doesn't work for that team, and how can it be smoother, and how can so in all of that, that's really big. That's like saying, I want to fix healthcare, which is like, right. Oh my God, it's too much. And
so, Danny,
it's like, yeah, go ahead.
So what's in terms of patient care, what do you think stands in the way of patient-centered care in the current model?
Well, I think that the current model is largely medical, where I think that health and getting better is such a small proportion is really medical for people. There's their whole life. The medical is very focused on itself, and it's very complex. It's a production, the medical system, and so it's very difficult for people. So whether it's patients or caregivers to navigate in that, they're removed from it. It's hard to get your foot in. I've listened to some of your shows, and you have people who are patients and caregivers on your show, and they described their challenges.
So do you feel that because it's a medical model and you want to move towards a model which looks holistically at the patient, which is not just the medicine, but their support system, the communication involved between all the parties that are involved in the support system and the medical system, how do you feel is the best way to address that going forward? What changes do you think we need to make?
We need to get more clear about what it is to have a health team. For me, clearly I'm part of my health team. Like everybody is part of their own health team. And then there are the people around me personally. So my wife, my kids, my friends. And then there's I see 6 different specialists. And so there's all those specialists and their teams. And then I use chiropractic and massage and acupuncture. And so they're part of my team. I think the first thing is to know who your team is. And it's really hard to build that team when you're like in trouble. It's sort of like something you got to do, starts with primary care. Does it work with you and your primary care physician? If not, find another one.
Do you feel HIPAA stands in the way because of all these restrictions on communication? How do you facilitate the communication among your team, given the restrictions that are on communication?
Well, I think the restrictions are kind of overblown. I mean, I think that, first of all, I can communicate with anybody. I don't need anybody's permission to communicate. It's about me. I can give permission to anybody to communicate about me. Now, what's difficult is the system is not set up to make it easy for me to assign that permission and to keep track of that permission. I do think that's a really big deal. But I think that the law itself is not as restrictive as, people make it out to be. So I live in Boston, and, mm-hmm. and I get my care at 3 different medical centers, and they are all have top of the line electronic health systems. But I'm still the guy that connects all the dots. Mm-hmm. I'm the guy that communicates. I'm the guy that, I've got to collect it. So there isn't a way, an easy way to, even here in Boston, where it's supposedly more advanced, it's really hard to do that, to communicate and share across all these different levels.
So, because of these restrictions, what is your method of helping other people to facilitate these communication issues in their lives? And how can people sort of reach out and find out more about building a patient-centered world, which allows them to communicate with all the parties involved?
So if I'm the communicator, I have to learn how to do that. And sometimes I work with people to help them learn how to communicate themselves in whatever relationship with their team, whether it's their doctor or their chiropractor or whoever. One of the challenges of all that is there's really a lot of information. And whereas some people who are advocating for patients, there's something called give me my damn data. And I think I don't want all that data. I don't know what to do with all that data. It's just too much data. So it's like I try to think about, well, what data do I want? And what data is important? The data that's important to me to share across settings and across teams is what am I trying to accomplish in my quest for health? So I have multiple sclerosis, and I have personally two goals. One is I want to progress as slowly as possible. And the other goal is that I don't want to take anything that's going to mess with my pathological optimism. I feel like it's the strongest thing I have going for me. I'm positive. So I have to share that across my team, that those are my goals. And then I have to have a plan. And my personal plan is, I feel like the danger to me is not so much VMS, but falling, because I'm weak, because, I stumble a lot. So I want to take care of myself, and I want to have my core strength. I want to have a best diet. I want to be stress-free, and then, not messing with my pathological optimism. It's, my life situation. And so I think what I'm trying to say is that, if you go and you look at medical records and the data in them, where do you see people's person-centered goals? It's not part of the data set. Well,
correct.
Crazy. There's a data set of, I need to take Copaxone, that's a drug I take. So, there's what about that? There's, like the doctors can deal with that kind of stuff, that I need lab work. But for patients, it's like about, pain, function, satisfaction with life, relationships. Those are the things that, people, you and I, are trying to accomplish in our lives, and our health can interfere with that.
So here's one of the problems that I'm curious about your input on.
Okay.
A lot of patients, when they get this bad news, when they get a diagnosis like multiple sclerosis, or they get a diagnosis like cancer, they know that they've got a very long road ahead of them, and it's going to be a tough road. And so because of that, it often takes them to an emotional place where maybe they're not the best suited at that moment or in that emotional space to work on the goals for themselves that may lead to the best care. How do you work with that? How do you help people through that?
Well, it's a really good point you're making. There's, the proactive part, which is, when you're well or you're a worried well person, it's like getting accustomed to, thinking about your health and what you're trying to accomplish. So there's the proactive, getting more used to something like that. But then I think you depend on your health team. So whether that's your family, your caregiver, your doctor, the nurse, whoever, if they can help you do that. But as you said, it's not an ideal world, and it's hard. This is really hard stuff to do, because you're right. When you're sick, God, what are you thinking about? You're thinking about how miserable you are and what a drag this is, and why me? And you're right. it's hard to be proactive. That's why I think one of the biggest thing is you gotta have people with you who are going to help you do this.
And so in building the team,
Yeah.
you want to carefully evaluate people who are on your team. But one of the important things I think is people who is buy-in, even from the medical professions. I mean, I think that one of the things that people experience is just being another number in a doctor's office, or actually having a sense of a relatedness to the doctor, where they've really taken ownership of your case and are invested in making sure that you get well. And I don't know how do you move from being a number to that investment? What can you do? And if you don't have that investment, should you change doctors, or should you try to continue to build with the doctor you have? What's your opinion on that?
Well, I have an opinion, but it's okay. So my opinion is, if it's not working, try something else. But not everybody lives in Boston, and sometimes you don't have choice. And so you got to make the best with what you have. And that's where I think it's really important to, again, have the team. And so that there are people who are helping you with this. Now, for me, I was lucky that I started with a fabulous neurologist when I got diagnosed. And then he left. And so I went in this process of interviewing neurologists, which was just a hoot to do, because the variation in physicians' responses to sort of being vetted and interviewed, so naturally I ended up with my next neurologist was somebody who was very comfortable with it, and I was looking for somebody who used portals, because I get worried, and I like to be able to shoot off an email. Should I worry about this? And it's nice to get a response of, don't worry about it. Or, yeah, come see me, or whatever. And so, I remember in one interview, the physician didn't use portals. But I'm lucky. I had a choice. I don't know if that really answers your question.
It does, but the follow-up I have is, for most people in the country, the ability to interview doctors is limited, especially because of Obamacare and the narrow networks that have been created for people. Yeah. So because of that, how do you recommend optimizing the care that they do get with the people that are available to them?
Well, again, I think the first thing is you need somebody there with you. Again, it is when the relationship with members of your team is difficult, those are hard things to navigate by yourself. Not everybody's like, go get them like me,
right.
As you're saying.
No man is an island.
Yeah. So I think that for one, you need help, but part of it is also you got to know what you want and ask for it, which is it's cultural, it's personality. I think it's a tough one. I don't think I have an easy answer for it. I just think it's something you got to move it an inch.
So where does somebody like a paid professional advocate fit in your space? And for people without the resources, is there an equivalent of a paid professional advocate that they could turn to?
The good news is that I think the industry is starting to realize the importance of navigators. As with anything, the quality varies, but more and more, health plans and doctors' offices, et cetera, are including the role of navigator for people who have, chronic illnesses or multiple chronic illnesses. And for people who can afford it, there's certainly services out there for navigation. And, there's people who are, have an elderly parent that doesn't live in the same state they do, for example, who, will hire somebody who's local to their parent to help them navigate. I think it's a growing field, but I think it's, depends on where you are and what you can afford and what you're comfortable with. It varies so much.
So I think that in the way there has to be training for people who are not just paid advocates, but for what you talked about, where there are people who are part of your team that are family members or personal loved ones who act as your personal advocate, and they have to know how to act in that capacity, and they also have to be willing to challenge doctors, because one of the other problems is people are afraid to challenge doctors.
Well, a really good example, like I find that in the behavioral health world, especially the mental health world and addictions, there's much more use of peers. So people with lived experience who are, supporting and helping to navigate. And I think that's a wonderful model. So, for me, it might be, somebody who has MS and has navigated that world. In the mental health world, it's somebody, who, has had depression or whatever, or addiction. And there's people who, and the role of the peer has become much more professionalized, in terms of being employed and supporting individuals. So I think it's a good model. And
support groups are available, right?
Yeah.
For people.
Right. I mean, and it's just like anything else, there's support groups and there's support groups.
Right.
Sometimes, you go online and, oh my goodness, it just seems like such garbage. And what are people talking about? And then on the other hand, sometimes it's brilliant and really helpful. And sometimes just being able to chat with people who are going through the same thing you are is, empowering and makes you feel not alone. Because that feeling of being alone, oh my goodness, like that's awful.
That's the worst. Yeah.
It is the worst.
Yeah, to be disconnected when you're struggling with something that's a long, ongoing process and a devastating illness is probably one of the things. So, does counseling help for that? For the not just the patient, but for the team members as well? Do you think?
Well, I think you're bringing up a really good point, because I think, actually, I put most of my energy into two groups of people. One is the caregivers, and then it's the people who are supervising frontline clinicians. So whether they're supervising doctors or nurses or therapists or whatever, I think those are the two areas where there's opportunity to have effective support. So caregivers, they need, one of my mottos is honor the caregivers, help the helpers, because our healthcare system couldn't survive without caregivers. I mean, they provide so much healthcare, and it's like ripe for burnout. And so I think when you say, you think about counseling and support, I think it's counseling and support of caregivers. And then I think it's the people on the clinician side, the people who supervise clinicians, being able to support. Being a clinician is hard work in this system. Oh, my goodness. And people are burning out so fast. Whether they're caregivers or clinicians, they're burning out. And we need to support those people. And so, anyway.
And
soapbox.
I love that. And show them a little love. Be appreciative, show them a little love. Make sure that we the people who you're providing care for, the team, acknowledges that they're doing a job of love and care, and not just find the negative, but also appreciate the general flow of work that they perform for a patient. I agree with you 100%. Well, it's really been a pleasure talking to you. I've learned a lot about how we can maybe participate together in creating a better world for our patients and the people who provide care for them. And it sounds like the key is communication and appreciation. If people want to get a hold of you, what's the best way for them to reach you?
Thank you. Well, I have a blog, which is www.health-hats.com. So www.health-hats.com. And, Danny at healthhats.com is my email address, and feel free to get in touch with me. It's such a challenging world out there. And again, my goal is, how do you move an inch on something that needs to go 10 miles? I think that's how things change, is one step at a time. So I love your show, and thank you so much for including me. I appreciate it.
And thank you for coming. This is Minda Wilson from Urgent Care. We will be back.